Do you want me to say and emergency medicine physician?
Sure, thank you.
Okay.
Puede proveer bolsas plásticas para frutas, verduras, carne y mariscos. ¿Cómo se puede evitar la tarifa de bolsas de papel? Evite pagar la tarifa de bolsas de papel al llevar consigo bolsas reusables cada vez que vayas de compras. Coloque sus bolsas reusables en el vehículo o al lado de sus llaves para no olvidarlas. ¿Y si olvido traer bolsas reusables? Va a haber una caja de bolsas prestables en muchas tiendas y usted puede usar una bolsa reusable sin costo. Si usted tiene bolsas extra, las puede dejar en la caja para
In an effort to spur change to be more environmentally sustainable, the 2018 Teen Council came to Steamboat Springs City Council with a proposal to do something about plastic bag waste in our community. In response, Council passed Ordinance 2699 banning carry-out disposable plastic shopping bags and imposing a 20-cent fee on paper bags at large markets in the city of Steamboat Springs.
Good morning. I'd like to welcome our virtual audience to this panel with local medical experts, first responders, and public health officials. This panel is being sponsored through a partnership with the City of Steamboat Springs and Routt County. My name is Lisa Schlichtman, and I'm the editor of the Steamboat Pilot Today, and I will be moderating. Before I introduce our esteemed panel, I would like to let people know that there will be future panels on a variety of topics surrounding the COVID-19 outbreak. We would ask you to send any questions you might have to covid@steamboatsprings.net, and those questions will help inform the topics for future panels. I want to begin, first of all, by saying I hope everyone notices that we are social distancing. Everyone is 6 feet away from one another. And I say that a little in jest, but I think that's very serious. We should all be focused on that right now. Let me begin by introducing our panel. We have Dr. Laura Sehnert, Chief Medical Officer and Emergency Medicine Physician at UCHealth Yampa Valley Medical Center here in Steamboat Springs. We have Dr. Brian Harrington, Routt County Public Health Medical Director, Kari Ladrow, Routt County Public Health Director, and Chuck Cerasoli, Interim Fire Chief with the Steamboat Springs Fire Rescue. I want to thank you all for being here, and I want to thank you for all the work that you are doing. I know it's basically around the clock almost, and I know this community appreciates you. So I'm going to begin with a question that I think a lot of people are wondering. And I should say these questions our people have submitted these either through the newspaper or the city. So first of all, who should be getting tested for coronavirus?
I'll go ahead and take that one. I would point out that there's a difference between what we want to do and what we're able to do right now. We are limited in our testing capability. To do the test, we have to collect specimens from the nose with a nasal swab. It has to be a special nasal swab. It goes into a viral medium with a special kind of fluid in it to keep the virus alive. Then it gets sent to a lab, which has to be able to do the specialized testing. There's several rate-limiting steps in doing a test. We started out with limitation of just basically not having many of the tests setups to do, so the labs that did them didn't have enough reagent and couldn't run the tests very much. Now we're running into a rate limiting step in that we do not have even enough of the swabs, the special kind of swabs, to collect them from the nose. So those issues are outside of our local control. I know that local clinics and the hospital and everybody in the state have been trying to obtain those supplies. So we therefore face a situation where we have a limited capability of doing tests, because we don't have the test ability with the reagent and the testing facilities. And now we're running into problems with even the materials, the specialized materials we need to collect the specimen. Let me step aside then for a minute and consider the three areas that we would want to be tested in. And I can tell you that all the providers in this community are frustrated that we can't test more. We would want to be tested more. The first area of interest for testing is individual medical care. We would like to test a person if it made a difference for their care. Right now, though, we have a challenge. There is no medicine for the COVID-19 infection. If we find out that an individual has it, there's no different treatment for it with that knowledge. So from an individual perspective, knowing that you have the infection does not change the medical care. You still get treated as if you have a respiratory illness. So that's my first perspective area. Knowing whether you have it or not at this point is not changing our medical management, except in some of the critical care situations in terms of knowing what our treatment options might be with somebody who's ventilated, for example. The second perspective of desire to test has to do with the public health realm. Typically, we preach that if you have a disease such as chlamydia, right? We track chlamydia, sexually transmitted diseases. We want to know who has it, and then we either treat or test their partners. So that's a standard thing in public health, is you want to define your cases, you want to define who their contacts are, figure out who's got the disease, and then that's how you control the public spread. We have not been able to do that in our country because of the lack of testing capability. So yes, we wish we could do that, but we can't. And then the third area of perspective for me is how we continue functioning in society. I hear stories of people who they take care of a sick elderly family member, and they're worried, well, how do I know that my cold is not COVID-19? And I can't easily tell them that. We have healthcare workers who are staying home from their places of work, not able to take care of people because they've got a cold, and we can't always tell what it is unless we do the test. There's lots of reasons. Workplaces want to know, can I let this person come back because they've been sick? It would be helpful from a society perspective if we could answer that at times to help people function more. So we have three areas of desire of bearing benefits of testing, and we're just limited because of that. Because of the limits, the state and nationally, we've placed some criteria for who prioritizes for testing. And so currently that is limited to hospitalized patients who have respiratory illness and might have it. There's been a decision made to test healthcare workers because one of our great fears is that if we get too many cases, it will overwhelm our medical system. But we need to have healthcare workers to make that system function. So there's a desire to have our healthcare workers cleared so they can return back to work. And then there's current even evolution on our prioritization now on whether we can even test some of our high-risk people if they have an illness. And that's simply because of the limitation of supplies. So a long answer, but I would summarize it by saying that we want to do more, but we're hamstrung because of the lack of resources to do the tests. And then because of that, we're trying to prioritize who to test.
Thank you. Is anyone else on the panel want to address testing?
I think Brian did a great job summarizing, from a hospital perspective, our job is to keep the doors open and have the available people there to take care of the people in need. And so maintaining the ability to test our healthcare workers so that we can be on the front line. I think it's important to note that we come here as representatives of public health and as representatives of EMS and the hospital, but also as frontline staff that are out fighting this illness and have the same concerns that any of you at home do. And our main goal is to make sure that when I wake up every day, I can get back to work and get back to be able to take care of the people in need, and this is part of that. We understand completely the frustrations, and I think another important piece of this is it is ever changing and ever evolving. Being a part of the UCHealth system has had tremendous benefits, one of which is having access to some more of things that develop as within the state, within testing kits that are becoming more commercially available. And so we are constantly readdressing what is our supply, where can we get more supply, and what does our testing look like. So bear with us with ever-changing criteria, but just know that we are working day and night to make this process as smooth as possible. Right now, we just want to be able to take care of our community.
And I would just like to speak to the amazing partnership that we've seen evolve out of public health, the hospital, all of the community clinics. We really have reached a juncture where participation in trying to obtain these resources has never been stronger. We are all working together, as you mentioned, around the clock to try to get what the community needs, and I think that's an important recognition of the entire community.
Thank you. I'm going to switch over. Chuck, I'm going to send this one towards you because we were talking about people working on the front lines. So your team is on the front lines, and we know it's hard probably to practice social distancing when you're treating an emergency medical situation. So how are you protecting your staff and still being able to do your job?
Yeah, we are on the front lines just like the rest of the folks in the panel. And we're, first and foremost, we're continuing to try to follow the recommendations that continue to come out. And as Dr. Sehnert had mentioned, they are ever changing. And so that poses a challenge. But we are staying on top of that. We currently, and the partnership that Kari referenced, in the county, we are taking stock of our PPE, our personal protective equipment that we have for everyone, the hospital, EMS, and everyone that needs it. And we are utilizing that when necessary. And so we start by really trying to get as much information we can from dispatch when we're called out. And then we have our officers take a step back, try to contact people by phone or from the driveway. And at this point, almost any call, we're taking that approach before we jump in and make contact with anyone, even household members. And so we're really focused on making sure our folks have the proper PPE. We're not putting ourselves into a situation that we then feel like we should have backed out of. So we're taking a slower go. And then we're really maintaining that our folks stay on top of their health as well. And that's an important message for us as well as everyone in the community. It's not, it's a mental health issue as well. And so we need to make sure that we stay healthy in that aspect, as well as speak up when we have a sore throat, speak up when we have a cough, and stay on top of that.
Thank you. Would you all like to add to that from your perspectives, from the nurses and the medical workers?
Yeah, maintaining our own health, I echo what Chuck said. We've just got to be a team in all of this. I'm incredibly thankful for the community and all the things that our community members are adhering to. I know that this is hard on everyone, physically, emotionally, mentally, financially. We are all in the same boat together, and I can't echo enough how thankful we are for the partnership in all of this. But I think making sure that you're keeping track of how are you doing, from a mental health. How are you dealing with this crisis? How is your family dealing with this crisis? We've definitely implemented some things within the hospital for support for our staff, speaking to exactly that. Then, of course, there's all the general things that you can do for your well-being. Don't smoke. Wash your hands. Don't touch your face. All the things that we've reiterated it again and again. And just so thankful for our community for really listening to that and hearing those warnings.
Okay. I think if there's one question I know we get through the newspaper over and over again, is why don't public health officials release the exact locations of where people who have tested positive for COVID-19 were in the community? People are saying, wouldn't that information help people know if they were exposed to the virus?
Yeah, that's a common question. In most situations, knowing the location where somebody was is not going to make a difference. It doesn't matter for the health. And some of the facts behind it are, it seems pretty consistent that this virus is documented to live no more than 2, maybe 3 days at the most. So for example, with this group of international travelers that were here, we didn't get information about that till well past that 3-day mark when we'd even be able to do anything about it in that case. I would also emphasize that the data that we receive and then the stories you read in the newspaper, they're talking about people being located together physically in an area where they have, they're socially close, this concept of close contact. So for example, if you talk about the bridge players down in Pueblo that we had here in Colorado, they had a large room where there were several tables of bridge players, and they've had several people who were positive there. The people who were positive all were in that room at the same time. It wasn't an issue of them being in that room on different days. No, they were in close contact, and that's a persistent theme that we see around the country, and you can read some other stories that come out. That's not a linear association in a location. It was because in time they were connected in one place at that time. We know that this virus is heavily dependent on its transmission through the aerosolization and close contact that way. I'm sure that it does pick up through direct contact, and we do have some guidelines that say that if a business, for example, has an employee who tested positive, that business will be asked to shut down for 3 days and go through cleaning for that purpose of allowing any of the residual virus there to disappear. So I don't want to say that would never matter, but as a real factor, it hasn't mattered in the cases we've had. And then also, once we are at the point of assuming it's in our community, the actions that we all take are not going to differ, right? I mean, we do the same social isolation, distancing, the same infection precautions. So for those reasons, we have not felt that there was a benefit to finding the locations. And yet at the same time, we realize that people's livelihoods, their ability to put food on the table and things like that matters if we unnecessarily target or lock down someplace. I'd like to comment on that just briefly in that when we talk about public health, the focus, quite frankly, is usually outside of any clinical exam room or hospital location. Public health has determinants. We call them social determinants of health. Do you have food? Do you have a roof over your head? Do you have an income and livelihood? All those factors are going to play into this as this goes out over time. Are we going to have more suicides in our county down the road? I don't know. I mean, that's just one example. Do the children get lunches that they normally would have been getting at the schools? There's a lot of things that play into this, and there's not an equation that gives us an answer that's one way or the other. But to get back to the point of the question, in the cases that we've had, there was no benefit in naming or locking down or doing anything with those places.
Thank you.
Lisa, if I could just follow up on that a little bit, one of the things we're starting to see with our response, because we are being very cautious, folks will see us out in the community responding in an ambulance with our full PPE on. And sometimes if that's happening in the house next door or the townhouse or the condominium that you're in, obviously that would make you concerned. And so what I'm urging is that people understand that we can't talk about what's going on with the call we're on and why we're there or anything like that, that those folks are entitled to the privacy of, that they were entitled to before this outbreak, and that that they respect that. And so we have been getting questions, what's going on? What are you doing? I have a right to know. And we just urge civility in this situation while we see that. It can be concerning when you see an ambulance and a handful of firefighters head to toe with protective gear. I understand that.
Okay.
And I should probably add too, and this wasn't the preeminent reason, but because we don't hide behind regulations, we do what's right. But yet there are policies both at the state level and the federal level that dictate, do we name places? What do we do with locations? In the case of individuals, there's issues to come up with things like the Americans with Disabilities Act and other regulations that do spell out for the rights of individuals too.
And I'd just like to say to that point that, and I think Chuck mentioned it a little bit, but people are experiencing a lot of fear right now, right? It is a natural human emotion when there's something that you feel is out of your control coming, and it may or may not impact your family. And so recognizing that fear, you have to balance that with people's privacy, and then also with compassion and treating people with dignity and with the respect and the privacy that they, as Chuck mentioned, had before. I think that's key in this, because there seems to be some element of stigma associated with if you're tested positive for COVID-19. There's definitely alarm bells ring and people take notice, and really focusing on making sure that we also are caring for those people, because it's a very scary time for them as well, and they deserve the compassion that we would give to other people with other disease process as well. And it could very well be your neighbor, it could be your family member, it could be you. And so I just would like for the community to recognize how important the human component of this is too.
Absolutely. Okay. Kari, I'm going to start with you on this one.
Sure.
We've heard the word or the phrase community spread, and there seems to be a bit of confusion about what that means.
Sure.
Can you explain that for us?
So community spread is a public health jargonish word that really means we don't know where the source of the infection, it's just not known. And just to express, that's frustrating for public health as well. Obviously, through contact tracing, we would like to get a definitive answer on every case. We would like to be able to isolate and quarantine every case and know all of the answers all the time. And I think recognizing that there are going to be some unknowns where we can't track down the source of the infection is important, and it's just a recognition that we need to have. And so as far as the community spread term, recently, I could speak to that source of infection was not known, and I think that is going to happen throughout the country, where we don't know where the infection originated in. And to reiterate to the community, reassure to the community that all the measures were taken place with that situation, and will continue to be taken with that situation, with other situations that come up, in order to isolate, quarantine, do the contact tracing, do the same process that we do for other public health investigations with this disease process as well. Do you have anything to add on that?
No, I was going to comment. Maybe if people are asking kind of about this spreading issue, the virus, people who get symptoms with it on average seem to manifest the symptoms within 5 days. That's what the data shows. And in all cases, symptoms seem to manifest within 14 days. That's why kind of this quarantine thing of 14 days for people. That plays into our debate sometimes of, where, did this group that was here, did they acquire it here? They could have acquired it here. It's not necessarily true that they got it somewhere else. But also, they very well could have gotten it somewhere else, came here, passed through our community, and then moved on. So it can be a little tough to know on the community spread issue too, just because of that timeline of if somebody gets symptoms, when did they first acquire the virus?
And I will say, just to clarify, the Colorado Department of Public Health and Environment, the recommendation was to assume that we have community spread. And that's an important distinction, because there is a difference between assuming that we have and confirming that we have community spread. And the end result is still the same. People still need to be practicing social distancing, doing all of the components that we know are successful with trying to mitigate the spread of this. And so I would like to focus rather on the community spread issue, on the prevention message out to people too.
Okay. Very good. Laura, I'm going to direct this to you, Dr. Sehnert. There's a lot of discussion about hospitals potentially not being able to handle a surge of patients. What is UCHealth, Yampa Valley Medical Center's capacity? And do you have plans in place to deal with a surge of patients?
Sure. So I'll take that on kind of two levels, both within just our facility itself and then within sort of UCHealth within the state. So capacity-wise, we are a 39-bed hospital. Those beds are divided between our intensive care unit, our special care nursery, our birthing center, and our regular floor patients. This is not something that we are being reactive to. Annually, we look at, should we have any sort of mass casualty or surge event within our community, what would we do? We practice drills, we communicate with the county, with the city, with public health, and really dig deep on how would we manage this should this come up. So luckily, we have a lot of resources that we've already prepared and can really draw on to help us in this time. We can look to previous surges with the H1N1 pandemic, with the Ebola, and sort of use those past experiences to help really look at what we're doing locally. This is, again, an ever-evolving, we reassess every day. What is our current capacity? What are we seeing as trends? Do we need to make any additional moves? But we're prepared to really handle the surge in the best way that we can locally. We've been looking at certain options within our four walls. We're looking at options sort of outside of those four walls should we need it. And then I think importantly, again, within UCHealth as a system and how we can really best care for the patients across the state. It's been an amazing resource to really have national experts in pandemic management, in surge capacity to really draw on their experience. We're able to draw on experience from what sister facilities are doing on the Front Range that have put up some of these tent-type facilities to really learn from how is it working, what is not going well, what could we do differently should we need to. Right now, we have excellent capacity, and again, it's just something that we continually monitor. The thing I would just again reiterate is we need to be partners in this, and so to run to the hospital or run to the emergency department when maybe you're not sure if you need to, the best thing that we can do is really try to do what we're talking about with the self-quarantining. And then if you're not sure what to do, we've got ample resources to help guide you in that decision-making process.
What would a couple of those resources be?
Yeah, so obviously, a great resource is always your primary care physician. We understand that primary care physician offices are equally as overwhelmed, so reaching out to them if you can't get in touch or you're having trouble or not able to go that route or you don't have a PCP, we also have really been relying heavily on virtual capacity. So within both the primary care physician offices, I know a lot of them have stood up virtual appointments. Within the UCHealth system as well, there's virtual health appointments that can easily be made. And we can get all of that information out. I know it's on the UCHealth website as well. We also have the Routt County and COVID helpline that was just set up. That's 8 a.m. to 5 p.m. 7 days per week. We also have the Ask a Nurse from Yampa Valley Medical Center for guidelines as well. So I think, and also, of course, CDPHE and all the websites that are out there as well. So there are a lot of resources. If you're not sure what to do, we just ask that you please, before running to the emergency department, really try to make an informed decision as to what is the best route of care for you.
Okay. Kari, what can we do as a community to limit the spread of COVID-19?
The guidelines are out there. The guidance has come down from the state as far as mass gatherings being less than 10 people. As the orders come out from the governor, I would encourage residents to take them seriously and to be as strict as they possibly can. We're at a critical juncture with all of this as a community. And while I appreciate, as Laura or Dr. Sehnert has mentioned, we don't want to inconvenience people. We don't want for people to have to make this sacrifice, but it's the time right now. And so I think making sure that vulnerable populations are being cared for. If you know somebody who is a senior, making sure that they have what they need, but then also making sure that they're adhering to the guidelines as well of avoiding contact with other people who may have been exposed to COVID-19 is very important. Vulnerable populations are obviously our seniors, but then also other people with comorbidities. We need to make sure that people are taking seriously the social distancing. I appreciate this setup here because it has been nationally, I think, referred to sometimes in a joking manner, or people, nationally have not taken it as seriously as it can, and it's been proven to work. And so we need to take social distancing seriously as a community as well. The respiratory and hand hygiene, I know we collectively, the community has been messaging out as much as possible, but also being a role model for your family. So the first, I'm sure that many of us are the same. The first thing we do when we get home is model washing your hands in front of your family and washing your hands periodically through the day, really standing up that type of role model behavior for your family and your loved ones to make sure that they are adhering to the guidelines as well. I think those are the main things.
Yeah, I think a recent note I've made, we're going to change our society to not working when you're sick. I think we've always kind of been in this mode where you slug it through and you go to work and kind of, when you're sick. This is changing that. And I think that's a key thing right now. If you're sick, stay home, because I am still learning of situations where people are struggling with some symptoms and they're coming to work. And I get it. People need a paycheck and things like that. But I do think that that's a key thing right now, is that people need to be observant on that recommendation. One other thing, too, I would say is travel matters now. If there's a community that seems to have widespread COVID-19 in that community, those communities are being identified, and we're not supposed to travel to them. That increases your risk, and I think there's some relevance there. And then, as Kari touched on, we need to care for the vulnerable in our community. So those who are now homebound, reach out to people, give them a call every day. The social isolation is going to be tough for a lot of people. Help them. I want to call out Matt. You know who you are, Matt. My mother is 83 and has lung disease, and she's been, what I say, bunkered down for a couple weeks. And one of her apartment neighbors brought her some groceries the other day. And that's the kind of neighborhood that we all need to foster.
That's wonderful.
And I would just recognize that this community is amazing. They're amazing people. We have an outreach of volunteers that want to come forth and to help. And that's spectacular. I mean, that is really something that's testimony to the people of Yampa Valley region. And so I just appreciate all the outreach I think we all have gotten from our amazing region.
Chuck, how has COVID-19 changed the way fire rescue and other first responders are responding to calls? Or maybe it hasn't, I don't know.
Oh, it certainly has.
Okay.
I think a lot of it is what I mentioned before. So the CDPHE and the, other organizations at the state and county levels, we continually look at our protocols and our procedures and try to figure out the best way to respond. And again, it comes from the two big points is we're here to serve the community, so we're trying to keep the community safe and we're trying to keep our responders safe. And so the big things is we have developed COVID protocols and response protocols. And so as I mentioned before, it starts with dispatch in our county communication center. Anyone calling the 911 system will notice they're asking a lot more questions now. And even if you're not calling in with a respiratory or potential COVID call, they're asking those questions because we do have people that are self-isolating. We do have people that maybe potentially, are at high risk. And so we want to know much more than we did before from the start. And then when we're arriving on scene, sometimes we're even getting phone numbers and having our captains, while responding, calling either the patient or someone in the household that we can talk to and say what's going on, what's happening, and get that more in-depth information as we're responding. When we arrive on scene, we're doing a little bit more of a driveway triage is what we're kind of calling it. And that's keep that distancing from the driveway, get a little bit more information, and really understand what we're going into. What we want to avoid is being all of a sudden in a room helping someone with a broken leg and have someone come up behind us and say, oh yeah, you know, I just came back from such and such a place, or someone in my household is self-isolating because of this reason. And then all of a sudden we're trying to backpedal. When we contact patients, based off of the information we get, if we're still suspecting possible COVID or flu-like symptoms really in general, we're sending one person in with proper protective equipment to make that initial contact and start doing the patient care and deciding where we're going to go. One of the things that's important to know is we are still open and we are still responding to everything that comes our direction, and we want to be able to maintain that. And so we're taking a very staggered approach. If oftentimes the reasons people call 911 is because they're in distress, and we're trying not to delay the care as quickly as we can, but making sure we're protected. And if needed, we're treating the patient like we would any other situation. If they're in respiratory distress, we will have the right number of people there treating them and transporting to the hospital. And that's true for all the EMS agencies in the county. We have the Emergency Operations Center stood up for the county, which is a great conduit for support for the whole region. And within this operations center, there are specific specialties that people are talking to. They're trying to make sure that everybody's getting the same information, both on the responder side as well as the public side. And we're using that as a means to support the needs of the community, to support the needs of the facilities, responders, and everyone else, and making sure that we maintain standard protocols and procedures. And to piggyback on that, they do have a volunteer coordination system set up in place. I don't know that number, but we'll get it onto the city site, that if someone is interested and feels they can help and volunteer, the Emergency Operations Center has a coordinator that's helping figure out where they're best suited. And then the other thing is making sure they're not doing something that would put themselves in harm's way as well.
Thank you. Fantastic.
Lisa, I just briefly added that the clinics in town are paralleling that. So the clinical facilities in town are screening patients similarly. We don't want uncomplicated respiratory illnesses coming into the facilities. And so part of the initial screening process is trying to determine whether they really need to come into the facility or not. When people do arrive there, if they have any symptoms but would deem that they need to be seen, they're wearing a mask to try to preclude them spreading things easily. And I want to echo Chuck's comment there that, you know, the key thing is if you're sick and need to be seen, we're taking care of you. And that still needs to go on.
Yeah, obviously echo that same within the hospital as well. You know, we are prepared, we are capable, we are here for you if you need us. Right now, we're just really trying to make some tough decisions and make some smart choices to make sure that we maintain that way. So some of the things that the hospital is and the caregivers within the community have instituted is for those procedures that might be elective, that don't necessarily need to be done right now, can we postpone those for a later date such that we free up both our hospital personnel, our caregivers, and our personal protective equipment. So trying to really make sure that we maintain that capacity, that's our goal. But if you have an emergency, we are open, available, and prepared to take care of you.
Fantastic. I guess another question, and I don't think that if you do think you have COVID-19, what should you do?
Yeah, just to, you know, again, reiterate, the most important thing is first to self-isolate. So really important that any exposures at that point you need to minimize as much as possible. And then again, if you're not sure, we've got a lot of resources available to help guide you as we went through the hotlines, the Ask a Nurse, the virtual visits, your primary care offices. So if you're not sure what to do, try to spend the time to find what resources are out there for you. And then obviously, if you are an extremist and feel that you're in need of hospitalization or acute emergent care, as Chuck and his team have said, and we reiterate, we're here for you.
Is it, and I guess I would just want to follow up with this fear, I think people like want to know for sure, but that is not a reality, correct? You're not going to, someone can't just say, I really have to know if I have COVID-19. They're not going to get tested. Is that the reality, most likely?
Yeah, it goes back to sort of what Brian said initially with the testing capabilities, and then also with what do we do with that information? And I know that's hard to hear, but we're going to give you the same message, which is stay at home, take care of yourself, and stay and try to keep from exposing other people. Those are the main things.
And this is not because providers don't want to. We're torn up about our inability to do this as well. But given the very limited resources and the guidance given on testing, we're trying to follow that guidance.
And another follow-up question, I think people are struggling to understand how contagious is COVID-19? How does it compare? You know, at the beginning, there was all sorts of crazy statistics out there in comparison to the flu. So is there any way to let the public know how does COVID-19 compare to other infectious diseases?
Well, the flu does get compared a lot. And there actually are some numbers that get thrown out when we talk about how contagious something is. And certainly what's been put out there is that the COVID-19 virus is more contagious as defined by if I had COVID-19, on average, I would infect 2-point-something number of people around me with it. Whereas if I have influenza, that number is closer to 1. And then there's also an issue of the serial nature of it. How long are you infected? So something like influenza, it appears, may actually be infective longer. You can infect people longer before you actually have symptoms. Now, that's still some of an unknown area with COVID-19, but it appears that that's a shorter time frame than with influenza. So we've got a bug that's particularly contagious. But again, it appears to be more of an aerosolized kind of close contact situation. You know, we don't have great fear that because you order something on Amazon that takes 4 days to get to you, that a piece of cardboard is going to carry the virus. They haven't shown that it survives like that. In fact, I saw something that said 24 hours on cardboard. No, I didn't do that test, but maybe that was correct. So it is clearly more infective in that sense. And then we talk a little bit about the fatality rate. And, you know, Mark Twain, there's statistics, damn statistics, and lies. It's tough talking about the fatality rate. In a pure sense way, if you wanted to say what a correct fatality rate is, you take a moment in time, you have 100 people who are infected, and you follow them out, and you say how many died. That's the most correct way of saying fatality rate. We don't have that ability right now. Instead, what we're doing is saying that we have 100 cases of it, and 5 died. But those 100 people acquired it over a different period of time. So I want to caution people on their interpretation of fatality rates. I think it's better just to look at it in absolute sense. This is not Ebola, right? Ebola has like a 90% fatality rate. You get it, you tend to die. In this case, with this virus, if you get it, you're probably going to do fine. But in terms of trying to debate whether it's 1% or 3%, and whether it's 20 times more fatal or not, I think our data on that is imprecise. And at this point, I don't know if it changes that much about what we're dealing with. And we can get to a point in the future where we are more like other viral illnesses. So again, if you take influenza, you're talking about a disease that we all carry a little bit of immunity to it because of previous infections. Fortunately, we have a vaccine that in good years is pretty effective for blocking it out for people. So at any given time with influenza, you've got a population where not everybody's susceptible to it, so we're not going to have that as many getting critically ill, and it doesn't spread disease because of herd immunity effects. Unfortunately, with this new novel coronavirus, none of us have pre-existing immunity to it. So we're all susceptible at one moment in time, and of course, you're trying to spread that out so we have the capacity to deal with it when it comes in.
Thank you. Kari, I guess one more question. Do you think there's more that public health officials could do to limit the spread of COVID-19 or the community in general?
I can speak to the county perspective of what's been done. So as Chuck mentioned, the Emergency Operations Center has been set up, and that's a team of dedicated resources that have, for quite some time now, been looking at what can we do specifically to prevent this from spreading. They've set up a joint information center because I know one of the things that people really are craving is information, and I think that's why we're doing this. They want to hear reassurance that we've got this, or we're working all together. And so I think that joint information center is really critical. But the further extension of the Emergency Operations Center is that the United Way and the Department of Human Services have paired together in how they're going to support the community for resources, for making sure that people are cared for if they do need to go into isolation and quarantine. And so I guess the long and short of it is that public health officials can't do this alone. This is not something that somebody can put a badge on and suddenly things will be better. But as a community, we can. And so that's the message, the take-home message. There isn't any one person that's going to make this a different outcome. It's going to be a collective effort from all of our residents and from everybody in the medical field and from everybody who's watching this to do their part in the mitigation of this.
Fantastic. That comes kind of the end of our questions for this particular panel. I did want to give you guys an opportunity just kind of to make something that each one of you, something maybe we didn't touch upon, a message that you want the community to know. So Chuck, we'll start with you.
I don't
Put
get a
me on the
chance to think
spot.
about it. I think I'll just tag on to something I said earlier is we are concentrating on making sure we continue our ability to respond to 911 calls, to the community's emergencies in any capacity. I think one of the big messages that I'm fairly certain would be echoed is if you're questioning whether you should call or contact or go in to see your doctor, think back about what you would have done prior to this and maybe use that as some guidance of that and understand that if you felt you needed to be seen or talk to a doctor or call 911 before this pandemic was taking place, that's probably a good indication that you should today. And if you didn't think you would, then maybe hang tight for a little while until you feel you're there. But we certainly don't want to portray the message that don't call us or don't reference us. We're trying to make sure we put those resources in place to help people with that. And so otherwise, we're just trying to concentrate on keeping our staff healthy so that we can maintain response through this event.
Thank you.
Yeah.
Brian.
I think that most of us that live in this community believe that this is a special place. And, we can give you data that tells why people move here, that our resources are above average for a rural community and all that. But I think we also feel it in our hearts. This is a special community and area throughout the valley, from Oak Creek up to Craig, all along the way here. This is a special area, so let's prove it. This is a global event. This is a national event. But we are living here and now. And I challenge everybody to matter. Matter in your own world, matter to your neighbors, matter to your community. If everybody on their individual basis matters as we deal with this illness and its effects, as a community we'll come through this. But it's going to require that everybody do their bit to matter. And so that's my challenge and my faith in our community is that we all are going to matter in getting through this.
Thank you.
I would also say sometimes I hear comments about, oh, this is just an overreaction, or we don't have to follow these orders, or this is being overblown by the media and all of this. And I would echo what Dr. Harrington said in that, are we really willing to take that chance? Are you as an individual, just because it's not going to impact you individually perhaps, because maybe you'll breeze through this as asymptomatic, are you willing to take the chance on someone who may be vulnerable that will be impacted by this? And I would also echo, I don't think that our community is willing to take that chance. And so I would encourage people to do just as Dr. Harrington mentioned, to take it seriously and to move through this as a community. And also, thank you to everybody that's watching and for all the work that's been done so far.
Yeah, it's hard not to get a little emotional with that kind of a question. And I think what I'd just say is I'm just incredibly proud of our community, of our caregivers, of our hospital leadership, our EMS, our public health. It has truly been an overwhelming couple of weeks. We have been working nonstop, round the clock, and I'm just incredibly proud of the dedication, the commitment, and the passion that's being put forth. We're going to make mistakes along the way, there's no question, and we might have to backtrack on things that we say or processes that we put in place, but just know that, that we come from a place of being in this battle along with you and on the front lines, and I'm just really proud of the caregivers that as the world runs away from this virus, we're running towards it to try to fight it.
Thank you all so very much. I just thank you for the time this morning. I thank you for the work that you all are doing. And it gets me. And we do live in a special community, and I hope the audience for these panels grows. And again, we are in this together at a social distance, but we are in this together. And I hope everyone remembers that. Information is key. Don't listen to false information, go to the experts. The newspaper will continue to try to provide as much information as we can, accurately and in a timely fashion. Please send questions to covid@steamboatsprings.net, and we will be holding more of these panels. And again, thank you for your time today.
Thank you.
Thank you, Lisa.